Okay, so picture this for a second. You go to tie your shoes, but your fingers just, they won't cooperate. Or maybe you try to catch a ball, and it feels like your brain and your body are speaking completely different languages. For millions of people, this isn't some what-if scenario. It's their everyday reality. All right, welcome to The Explainer. Today, we're going to pull back the curtain on a condition you might know as dyspraxia, or to use its full name, developmental motor coordination disorder. We're going to dive into what it is, why it's so much more than just being clumsy, and how, with the right support, people with this condition can absolutely thrive. So, first things first, let's get a really clear picture of what we're actually talking about here. What exactly is dyspraxia? Let's get this straight from the get-go. Dyspraxia is a neurodevelopmental condition. All that means is it's rooted in how the brain develops. It specifically messes with motor coordination. But, and this part is absolutely critical, it has nothing to do with how smart a person is, and it isn't caused by some other medical issue. It's its own distinct challenge. So these challenges, they tend to fall into two main buckets. First, you've got your fine motor skills, the small, precise movements we make with our hands. Think about how tough it would be to write clearly, button up a shirt, or even just use a fork and knife. Then you got the gross motor skills. These are the big whole body movements like running, jumping, or playing sports. Dyspraxia can hit either one of these, or sometimes both, which can make a whole bunch of daily activities feel incredibly hard. So you might be wondering, where does this come from? Well, the truth is, it's pretty complex. There really isn't one single reason. What the research tells us is that it's likely a mix of things. It can run in families, it can be linked to how the brain develops before or right after birth, and there might even be environmental factors. It also shows up pretty often alongside conditions like ADHD or autism, which just goes to show you how connected everything is in our brain's development. But here's the thing, these motor challenges, they're really just the tip of the iceberg. They create this ripple effect that goes way beyond just being clumsy, touching nearly every single part of a person's life. Just try to imagine the day-to-day grind. Poor balance could mean you're tripping and falling all the time. Handwriting becomes this constant, frustrating battle. Even simple self-care like buttoning your own shirt can be a major source of stress. And for kid, things we take for granted like playing on the playground can feel like impossible tasks, making it tough to hit those key developmental milestones. And that right there, that brings us to the real heart of the matter. The physical struggle almost always spills over into an emotional and social one. I mean, can you imagine feeling constantly let down by your own body? Or having to sit out of games with your friends because you can't keep up? That's what leads to things like low self-esteem, anxiety, and pulling away from other people. And this is exactly why dyspraxia is so much more than just a physical condition. Okay, so if the signs are there, how do we move from just having a hunch to actually understanding what's going on? That brings us to the formal process, to how the condition is actually identified. The path to a diagnosis is really careful and thorough. It's not some quick checklist. It all starts with a deep dive into a child's developmental history. After that, professionals will actually watch the child's motor skills in action. They team up with specialists, like occupational therapists, and then, finally, they look at how these challenges are really affecting the child's life, at home, at school, and with their friends. It's a whole picture kind of thing. So once the challenge is really understood, the focus shifts completely. It's all about support. So let's take a look at the blueprint for helping a child build the skills and, just as important, the confidence they need. A really great support plan gets that improving motor skills is just one piece of a much bigger puzzle. The goals are way broader. Yeah, you want to keep the child safe, but you also want to build their self-esteem, help them succeed with friends and in the classroom, and, crucially, empower the entire family. It's really about supporting the whole child, not just their physical movements. So, how do you actually make all that happen? Well, it starts at home, creating a safe space. From there, it's all about building skills, breaking down big tasks into smaller, manageable steps, and giving tons of positive reinforcement along the way. And this part is huge. It involves teamwork and advocacy. Working with therapists and making sure the school is providing the right kind of support, like maybe extra time on tests or adapted PE classes. If there's one thing to take away about support, It's this: nobody can do it alone. It's not a solo mission. Success really, truly hinges on teamwork. When the family, the therapists, and the teachers are all on the same page, all working together, that's when a child gets the best possible chance to really shine. Which brings us to our final and maybe our most important section. What does success actually look like? What does it really mean to thrive with dyspraxia? Success here isn't about finding some kind of cure. It's about seeing all these positive changes take root. It's a child whose coordination is getting better, yeah, but it's also a child who is eagerly joining in on activities they used to avoid. It's seeing their confidence grow and their anxiety start to fade away. It's a child who's making friends, who is staying safe, and who is supported by a family that feels empowered and knows how to help. That is what thriving looks like. And that kind of leaves us with one final thought. Understanding a condition like dyspraxia is the first step, for sure. But the next step is to ask ourselves, whether it's in our schools, our communities, or our own families, what can we do to foster more patience, to adjust our expectations, and to build environments where every single person, no matter what their unique challenges are, has the space and the support they need to shine?